The world is full of health advice, but very few messages are as critical as this one. Cancer often begins quietly, without dramatic symptoms, and many people miss the early signs simply because they look harmless or easy to ignore. Studies from major cancer institutes consistently reveal that early detection dramatically improves survival rates, yet countless people delay medical attention because they think their symptoms are due to stress, aging, or minor infections. The purpose of this video is to bring clarity, not fear. It is to help you understand what your body may be trying to tell you long before cancer becomes advanced. Over the next few minutes, you will learn the 10 most important warning signs that should never be ignored, why they happen, how they feel, and when to seek medical help. If you want to protect yourself and the people you care about, watch this video to the very end and share it with someone who might need it today. Everyone deserves to understand their body better. Cancer does not always begin with pain or dramatic symptoms. In fact, many early-stage cancers are completely silent and easily mistaken for everyday problems. Fatigue, weight loss, digestive changes, voice changes, or unexpected lumps can all seem small at first, but they often provide the earliest window of time when treatment is most effective. Your body is always communicating with you, but many of us are so busy or overwhelmed that we miss the small signals that matter most. This video is your reminder to slow down, pay attention, and listen to what your body is saying. As we go through each warning sign, think about what is normal for your body and what feels new or unusual. The more you understand these early signs, the better chance you have of taking action quickly. Let's begin with the first warning sign that often goes unnoticed, but is one of the clearest red flags your body can give. Unexplained weight loss is often one of the very first signs that something deeper is going on. Many people think losing weight without trying sounds like a good thing, but when weight loss happens suddenly or without clear cause, it can be a major indicator of cancer. Doctors generally consider it concerning when a person loses 10 pounds or more without making changes to their diet, exercise, or lifestyle. The reason cancer causes this is because tumors can change the way your body uses energy. Cancer cells use far more calories than normal cells and interfere with your metabolism, causing your body to burn energy at a much faster rate. Some cancers, such as pancreatic, stomach, lung, and esophageal cancers, are especially known for causing rapid weight loss because they interfere with digestion and nutrient absorption. For some people, weight loss is accompanied by early feelings of fullness, nausea, or a decrease in appetite. For others, the weight simply melts off without any noticeable change in appetite at all. If you step on the scale and notice you have lost weight without trying, especially if this happens over a short period of time, your body may be signaling that something serious needs attention. Even if it turns out not to be cancer, unexplained weight loss always deserves a medical evaluation. The second warning sign is persistent fatigue. This is not the kind of tiredness you feel after a long workday, a night of poor sleep, or a stressful week. Cancer-related fatigue runs much deeper. It is a heavy, dragging exhaustion that does not improve even after rest or sleep. People often describe it as a feeling that something inside them has been drained. This type of fatigue occurs because cancer affects the way your body produces energy. Tumors release substances that interfere with how cells convert food into usable energy. Some cancers also cause hidden internal bleeding, leading to anemia, which creates even more fatigue. Others create chronic inflammation in the body that forces your immune system to work overtime, leaving you with little energy for anything else. You may find everyday activities like climbing stairs, carrying groceries, or even getting out of bed suddenly feel much harder. You may feel mentally foggy, unfocused, or unusually weak. What makes this symptom even more concerning is that people often ignore it, blaming age, stress, or lifestyle. If you feel exhausted for weeks and nothing you do seems to restore your energy, it is important to seek medical attention. Persistent, unexplained fatigue is one of the most common early signs of cancer, and it is the body's way of telling you that something is interfering with its normal functioning. The third warning sign is unusual lumps or swelling. One of the earliest and most visible signs of cancer is a lump that was not there before. These lumps can appear anywhere on the body, including the breast, neck, armpits, abdomen, groin, or testicles. While not every lump is cancerous, any new lump or swelling that does not go away should always be checked by a doctor. Cancerous lumps often feel firm or fixed in place, meaning they do not move easily under the skin. They may grow slowly over time or remain the same size for a while before becoming larger. Some lumps are painless, which is why many people overlook them. However, pain is not a reliable indicator. For example, breast cancer lumps are frequently painless, while lymphoma lumps may feel tender. Cancers that begin deeper inside the body can also cause swelling without a clearly defined lump. For example, ovarian cancer can cause abdominal bloating, while thyroid cancer can create a swelling in the neck that affects swallowing or breathing. These changes happen because abnormal cancer cells multiply uncontrollably, forming a mass that presses against nearby tissues. Checking your body regularly helps you notice changes early. If you discover a lump that feels unusual, grows, or does not disappear after a few weeks, you should seek medical evaluation as soon as possible. Early detection can make a major difference in treatment outcomes. As we move forward into the next warning signs, pay attention to how each one may appear subtly but carries great importance. Cancer often begins quietly, but your body always gives clues. The key is learning to recognize them before they grow louder. Cancer rarely appears suddenly. In many cases, it begins with small symptoms that come and go, easily mistaken for minor issues like allergies, seasonal infections, digestive discomfort, or simple fatigue. But when these symptoms persist far longer than normal or become more intense, they can reveal what is happening beneath the surface. The next warning sign is one of the most commonly dismissed symptoms, yet it can be a powerful early clue that something serious is developing. A persistent cough or ongoing hoarseness is the fourth warning sign you should never ignore. A typical cough from a cold or allergies usually disappears within 1 to 3 weeks, but a cough that lasts longer than 8 weeks may indicate something more concerning. Lung cancer is often associated with chronic coughing because abnormal cells irritate the airways, causing constant inflammation and making the lungs more sensitive. But a long-lasting cough is not only linked to lung cancer. Cancers of the throat, larynx, and thyroid can also cause voice changes, hoarseness, or a raspy tone that does not improve. Many people assume they just lost their voice or blame dry weather. But cancer-related voice changes last a long time and may gradually worsen. You may notice that your voice sounds deeper, strained, or unusually weak. Some people experience coughing fits that interrupt their sleep or daily conversations. Others cough up small amounts of blood or mucus streaked with blood, which is always a sign that requires immediate medical attention. The key here is duration. A lingering cough that refuses to go away, especially if you do not have a cold, or if it lingers long after the cold is gone, is the body's way of signaling that something deeper needs attention. If your voice changes for more than 3 weeks, or you notice a cough that feels different from the usual, it is crucial to have it checked by a healthcare professional. Next, we move into the fifth warning sign, which involves changes in bowel habits. While digestive changes happen to everyone occasionally, persistent or unusual bowel changes can indicate colon or rectal cancer. These changes often develop slowly and subtly, making them easy to overlook. For example, you may notice your stool becoming narrower, which can happen when a tumor inside the colon partially blocks the passage. You might experience diarrhea or constipation that lasts much longer than usual, not resolving even after dietary adjustments or over-the-counter remedies. Some people notice a sudden urgency to use the bathroom, while others feel like they cannot fully empty their bowels. These symptoms can happen because tumors interfere with the normal movement of waste through the digestive tract. Blood in the stool is another serious warning sign. Sometimes the blood is bright red, indicating bleeding close to the rectum. Other times it appears dark or tar-like, which suggests bleeding higher up in the digestive system. Many people mistake rectal bleeding for hemorrhoids, but when bleeding persists or changes over time, it should always be evaluated. Unexplained abdominal cramps, bloating, or discomfort that does not improve may also be linked to growing tumors. Because colorectal cancer is one of the most common cancers worldwide, knowing and recognizing these early bowel changes can save lives. If your digestive patterns change dramatically or remain abnormal for more than a few weeks, your body is trying to alert you to something important. The sixth warning sign is closely related to bodily functions as well. Changes in urination can indicate prostate, bladder, or kidney cancer. Many people assume urinary changes are simply due to aging, dehydration, or minor infections, but persistent symptoms should never be dismissed. You may notice you need to urinate more frequently, especially at night, or that the urge to urinate comes on suddenly and intensely. Some people feel pain or a burning sensation during urination, even though tests show no infection. Others notice difficulty starting or stopping the stream, which is especially common in prostate cancer. A weak or interrupted stream can occur because a tumor enlarges or presses against the urinary tract. Blood in the urine, even in small amounts, is another major red flag. This blood may appear pink, red, or brownish, and while kidney stones and infections can also cause this, cancer must always be ruled out. Lower back pain near the sides of the spine may indicate kidney involvement, especially when combined with urinary changes. What makes these symptoms concerning is that bladder, kidney, and prostate cancers often remain silent until they begin pressing on nearby structures, making urinary habits one of the earliest signs the body gives. If your urination pattern changes suddenly or consistently feels different, do not ignore the message. Early tests can detect problems long before symptoms become severe. The seventh warning sign is unexplained bleeding or bruising. This is one of the clearest and most alarming signals your body can send, and it should always be taken seriously. Certain cancers affect the blood's ability to clot properly, leading to frequent or unusual bruising. Leukemia, for example, disrupts normal blood cell production, reducing the number of platelets responsible for clotting. As a result, you may notice bruises appearing in places where you do not remember getting injured, or they may appear larger and darker than usual. These bruises can take longer to heal and may show up repeatedly. Similarly, unexplained bleeding can occur in different areas of the body. Nosebleeds that occur without cause may indicate blood-related cancers. Bleeding gums while brushing or flossing, despite having good dental hygiene, may also be a sign of blood abnormalities. For women, abnormal vaginal bleeding between periods or after menopause is a major red flag that could indicate cervical or endometrial cancer. Coughing up blood, vomiting blood, or passing blood in the urine or stool are all serious symptoms that require immediate medical attention. When cancer interferes with blood cell production or damages organ tissues, bleeding becomes more common. These symptoms often appear before any pain is felt, making them an important early detection point. If you observe recurring bruises, prolonged bleeding from small cuts, or any bleeding without explanation, contact a healthcare provider right away. As we've seen so far, the body provides many signals when something begins to go wrong. Some symptoms may seem small, others may feel concerning, but it is the combination of persistence and change that matters most. Your body always communicates. The challenge is recognizing when the message is urgent. The human body is incredibly intelligent. Long before symptoms become severe, it quietly signals that something unusual is happening. Some signs are subtle and easy to brush aside, while others slowly grow stronger over time. What matters most is recognizing symptoms that persist, evolve, or simply feel different from what is normal for you. The next warning sign is one of the most misunderstood, because many people assume it is a normal part of aging or stress, when in reality, it can be a crucial early clue. The eighth warning sign is chronic or unexplained pain. Pain is one of the body's most important protective mechanisms. It alerts you whenever tissue is irritated, inflamed, or injured. But cancer-related pain is different because it often appears without a clear reason. For example, persistent back pain could indicate tumors pressing on nerves or developing in organs like the kidneys, spine, or pancreas. A dull ache in the pelvic area may be linked to ovarian or uterine cancer. Bone pain, often described as a deep, aching discomfort, may occur when cancer spreads to the bones or when bone marrow is affected by leukemia. Some people experience pain in the chest that is not related to the heart, while others develop headaches that become more frequent or intense. What makes cancer-related pain concerning is that it does not improve with rest or common remedies. Pain medications may only provide temporary relief or no relief at all. Another key clue is progression. The discomfort may start mildly and gradually become stronger over weeks or months. Others may notice pain that is worse at night or wakes them from sleep. It's true that everyday life can cause body aches, especially as we age, but pain that lingers without explanation should never be ignored. When cancer grows, it can press on nerves, muscles, and organs, sending signals the body wants you to notice. If you experience pain that lasts longer than expected or keeps returning to the same area, a doctor should evaluate it immediately. The 9th warning sign is unusual changes in the skin. Your skin is the largest organ in your body, and often the first place where internal problems become visible. Skin changes that may signal cancer include new moles, existing moles that grow or change shape, or patches of skin that appear darker or irregular. Skin cancer, including melanoma, basal cell carcinoma, and squamous cell carcinoma, frequently begins with a spot or lesion that looks different from everything else on the body. For some people, the warning sign is a sore that does not heal, even after weeks. This can happen because cancer disrupts normal cell function and prevents proper healing. Others may notice redness, swelling, or tenderness around a mole or patch of skin. A mole that becomes itchy, bleeds, or forms a crust is especially concerning. Not all skin changes are related to skin cancer. Some cancers elsewhere in the body create skin symptoms as well. For example, ovarian and pancreatic cancers may cause darkened patches of skin, while blood-related cancers like lymphoma can cause itchy rashes. You may also notice unexplained lumps under the skin, which can indicate swollen lymph nodes responding to cancerous activity. The skin is an external window into internal health. Paying attention to changes in color, size, texture, or healing patterns gives you a powerful advantage in early detection. If you see something new, something changing, or something that simply looks different from the rest, it is important to get it checked by a dermatologist or healthcare provider. The 10th and final warning sign involves persistent difficulty swallowing or ongoing digestive discomfort. Many people experience occasional heartburn or indigestion, but when these symptoms become frequent or severe, they may indicate cancers of the esophagus, stomach, throat, or pancreas. Difficulty swallowing, known as dysphagia, can feel like food gets stuck on the way down or moves more slowly than usual. Some people feel pain when swallowing or begin avoiding certain foods because it becomes uncomfortable. Over time, this can lead to weight loss, malnutrition, and dehydration. Chronic indigestion, bloating, burping, or nausea that does not improve with medication may also be early signs of digestive cancers. Tumors can interfere with the normal movement of food through the digestive tract, causing pressure, irritation, and inflammation. Some people may experience vomiting after meals or persistent discomfort after eating even small amounts of food. Others may notice their appetite shrinking, not because they are trying to eat less, but because their body is struggling to process meals. What makes this warning sign important is that many individuals assume digestive issues are just a part of aging or stress. But when these symptoms last for weeks or continue to get worse, it is essential to seek medical evaluation. The digestive system is sensitive and responds quickly when something is wrong. Listening to these early signs can lead to earlier diagnosis and significantly more effective treatment outcomes. You have now learned 10 of the most important warning signs of cancer that should never be ignored. Each one may seem small on its own, but persistence, progression, and change are what separate everyday symptoms from potentially serious ones. Cancer often grows silently, and your body speaks long before the disease becomes advanced. The goal is not to create fears, but to empower you with knowledge, awareness, and confidence. A good understanding of your body is one of the greatest tools for protecting your long-term health. If you notice unexplained weight loss, persistent fatigue, unusual lumps, a long-lasting cough, digestive changes, urinary problems, unexpected bleeding, chronic pain, skin changes, or difficulty swallowing, your body is asking you to pay attention. Early detection can make all the difference. Many cancers, when found in the early stages, have far higher survival rates and respond better to treatment. The most important step is to trust your instincts. If something feels different or simply does not seem right, it is worth discussing with a healthcare professional. You know your body better than anyone else. Do not ignore its signals. Thank you for watching and taking time to learn about these life-saving warning signs. Share this video with someone you care about, because this information could help them recognize symptoms they might otherwise overlook. If you found this helpful, make sure to like this video, subscribe to the channel, and turn on notifications so you never miss our future health content. Stay aware, stay informed, and above all, stay healthy.